So we are going to do alcoholic liver disease and or just pathogenesis. So what happens is you consume alcohol. So you consume alcohol, what is going to happen? You have two enzymes in your body, alcohol dehydrogenase and acetaldehyde dehydrogenase. What is going to happen is they are going to metabolize this alcohol, and I have demonstrated metabolize as this triangle. So what's going to happen is lots and lots and amounts of NADH is going to be produced. NADH is nicotinamide adenine dinucleotide, H is for hydride. So yeah, so NADH lots and lots of amounts is gonna be produced, and what is it gonna do? So much this have causes a disruption in the balance of redox potential. Okay, I represent this balance like this. So the redox balance is totally disturbed. So where you have hepatocytes, ADH and ALDH is in your hepatocytes. So when increased amounts of NADH is produced, it is going to disrupt the redox balance in your hepatocytes. I'm going to represent hepatocytes as this this hexagon. It's not ideally heptagon, but it's an hexagon. So yeah, so it's gonna disturb the redox balance. So what is gonna happen when your redox balance is affected? Three most important things are gonna happen. One is lipogenesis. Then is suppression of beta oxidation. And the third important thing, increase in enzymes for fatty acid synthesis. Okay, so yeah, three things gonna happen: redox balance, lipogenesis, suppression of beta oxidation, and increase in fatty acid synthesis enzymes. Okay, lipogenesis, as the name itself suggests, it is genesis of lipids. Then suppression of beta oxidation. What is beta oxidation gonna do? Beta oxidation is gonna metabolize your lipids. So suppression is going to happen, so beta oxidation is not going to happen, so lipid is increasing, and synthesis of fatty acid synthesis enzymes are also increasing, which will in turn leads more lipid accumulation in your hepatocytes. So now what happens is you have to also remember that alcohol causes peripheral catabolism of fats. Okay, peripheral catabolism of fat. So once this is going to happen, lipid pool is going to increase tremendously. So lipid pool increases, and see, this is going to add up. This is going to add up, and what is going to do? What is going to happen? Accumulation. So accumulation is going to happen. So once your accumulation of lipids is going to occur inside your hepatocytes, what is going to happen? There will be impaired assembly and secretion of lipoproteins. So basically your liver is storing lipids, and in a normal functioning liver it will transport the lipids to your rest of your other tissues like your skeletal muscle, intestine, etc. But since there is too much lipid, like too much honey is poisonous, too much lipids is going to disturb that process. Now the exact mechanisms behind your hepatocyte injury, we have CYP2E1 induction. This is an enzyme, one of your cytochrome P450 system. So when you consume high levels of alcohol, This is gonna your CYP2E metabolism of alcohol produces lots and lots amount of reactive oxygen species, ROS. So once this ROS accumulates, you know that ROS is very damaging to your cytoskeleton and cellular protein membranes, mitochondria. So and it's gonna lead to your apoptosis. Next is methionine metabolism. Your methionine metabolism is gonna so the alcohol is gonna impair your hepatic metabolism of methionine. So now since there is already too much lipids already there, so your methionine is gonna be left over by the liver. And what methionine is important for is it is because of one thing, glutathione. So your glutathione, you know that glutathione is very important for preventing oxidative injuries. So your glutathione is gonna decrease very much, and that is gonna further escalate your hepatic injury. Next we have your important component, acetaldehyde. Acetaldehyde itself is very lipid, it is going to induce lipid peroxidation, and it is going to disturb your cytoskeleton and membrane function, and it will also leads to production of neoantigens. Now it is your liver is already in this drastic condition, and when you consume drugs which are hepatotoxic like paracetamol or rifampicin, your hepatocyte injury will drastically increase. And in case of bacterial enterotoxin from your guts, so from your gut, it will induce inflammatory responses. So we have bacterial enterotoxins, fourth number, enterotoxin, you have drugs, and further your damages will lead to inflammation will lead to chronicity, and chronicity to liver fibrosis to cirrhosis. Your vascular perfusion will decrease, and you will land up in terrible state.